the last speaker for the day. Let me finish it quickly. So I'll tell you why I ditched my 30-degree scope. Vision is the most dominant sense that we use as physicians to treat our patients. And for arthroscopy, Professor Takagi and his student, Dr. Watanabe, they started off. And this number 21 scope, which was introduced by Dr. Watanabe, is the thing which made arthroscopy famous. And at the same time in Austria, Dr. Eugen Bircher also reported about arthroscopy. And then there were other improvements in it, fiber optics, then the rod lens. And the scope, as we know today, was devised somewhere around 1970s with cold light, rod lens, and an angled tip. The visualization system has undergone a sea change, and it's still evolving with the wireless cameras now. And arthroscopy is a big market. It's almost 10 billion market in the world. But the scope remains the same. So for the ARS, you could let us know So most of you know about all of the scopes. 30-degree scope is standard optics for almost all of us. It is easy to use. There is no loss of orientation. It's widely available. However, because of the increasing the range and complexity of arthroscopic procedures these days, we need to see more through the same scope. How do we do that? We came up with the 70-degree scope, but unfortunately, it's very difficult to use. If you've used it, you'll know that it's pretty confusing and has got a steep learning curve, and you want to use it in the most complicated case when you're not ready for it. So once I was using 30-degree scope, and this is what happened, blank screen. The scope got caught just in the OT, and the only thing available to me was an ENT scope, a 45 scope, which would fit into the arthroscopic cannula. So I took the 45 scope, finished it that day, and then went and tried to see what is happening. And then the ENT surgeons use quite different scopes, 30, 45, and 70, and they are very similar to what we use in arthroscopy. So for me, 45 scope is jack of all trades. It combines the optical benefits of both 30 and 70-degree scopes. It has an element of forward vision. You don't lose orientation, and actually the learning curve is almost non-existent with a 45-degree scope. It provides a far bigger field of view, and all you need is a 45-degree scope to do any procedure in any joint. If you look at this, by turning around the 45-degree scope, your field of view is almost 300 degrees, which is 100 degrees more than what you get with a 30 scope. And the peripheral image distortion, you look at the bottom images and you can see that the 30-degree scope is actually far worse than the 45-degree scope. If you look at these two videos, I've shot them with the scope at the same distance from the checkered board. And you can see the 45-degree scope, field of vision, and the 30-degree scope. You can see 45-degree scope is providing far bigger field of vision, and the distortion's less as well. If you look at these two videos, me probing the medial and lateral menisci, you won't be able to tell whether this is 30-degree or a 45-degree scope. They were both done with a 45-degree scope. You don't lose orientation with 45-degree scope. For an ACL, 45-degree scope is fantastic because you can visualize the lateral wall of the notch very easily. You don't need any accessory portals. And the notch is almost 50% bigger than when you're using a 30-degree scope. And even the tibial insertion, you can see very clearly. You can see here the lateral wall of the notch is quite easily visible. You can palpate the back and then come back and mark your entry points for anatomical tunnels. For the next few videos, what I've done is I've just put a tape, as you can see on my cannula there, just to make sure that the depth of insertion of the cannula is equal when I'm using both the scopes. You see the posteromedial corner here, you see the 30 and 45-degree scopes, and you see the field of vision provided by 45-degree scope. You can see so much with a 45-degree scope. You can see the posterior ramp, and then you can, it is very easy to spot any injuries in this region. So If you look at the PCL TBL footprint, this is looking from the anterolateral portal, you're looking down, and you see the difference between the field of view for 45-degree and 30-degree scope. You can very well do the TBL tunnel with the scope in the anterolateral portal when you're using a 45-degree scope. Look at the popliteal hiatus. Again, it's pretty straightforward, very easy to use, and you can see so much detail with a 45-degree scope as opposed to a 30-degree scope. So with us doing so many complicated procedures in every corner of the knee, I think it's time to get more vision, and then that is, with the 45-degree scope.
We still haven't managed to convince 10%, but I'm sold on the 45-degree scope. And we are going to have you next year to see its benefits in shoulder surgery too. It's amazing, I mean, the field of view that you've shown.
So why did I ditch my 30-degree scope? Because my 45-degree scope is jack of all trades. Orientation's not compromised at all. There is a huge big field of view and short learning curve, very short learning curve, almost non-existent. And it combines the benefits of both 30 and 70-degree scope. Thank you.
Thank you very much. I think one of a very good presentation. This is open for discussion. How many of you have used the 45-degree scopes? Is it only the ENT scope you have used, Nagaraj? And do you use it routinely? What are your views? Do you feel something similar to what Sunil has shown?
Just like Sunil mentioned, when I started initially as a lecturer, there was only one scope available from the ENT guys, which fit onto the sheet which we use. So I've used it, and he's right. It has got its advantages. It's exactly in the middle between 30 and 70. But at the same time, if you're used to a 70-degree scope like me, because I do hip arthroscopies, I do use it in the shoulders for subscap sometimes, then that view is unmatched. So probably for somebody who's not comfortable with 70, this is a good option to have.
I would put it the other way around. I would say that yes, you can get used to 70, but then I would say you should stop using 30, because once you get used to it and it's just a matter of few cases, you'd never go back to 30.
So companies are coming up with a technology that the same scope can be shifted to 45 as well as 70. So I think it's a good option actually.
Yeah.
So the technology is there now. I think this year it's going to be launched. You can change the same scope into 30, 40, 70.
They are also coming up with a wider view angle scope with the same angle actually. Yeah.
Thank you so much, Sunil. Please accept a small token of regards from the organizing team.